This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
All right, well, good morning. This was kind of a funny emergency medicine study I saw recently. The study looked at whether patients being on their cell phones when we first walk in the room was associated with them being less sick. So I think we all probably have a notion that if you go in and someone won't get off their phone and there's probably not as much wrong with them, so they actually went to study this. And it was kind of interesting. They actually used Scribes who would go in and they were doubling as unknown kind of secret research assistants that they would be charting, but they would also document whether the patient was on their phone or not. And they looked at, if you were on your phone, was there a higher rate that you got discharged? And in the study, it did show that. Interestingly, there weren't a ton of patients who were on their cell phones. It was like around 15% of the patients were actually on their cell phones. I think it would be higher. Patients who were on their cell phones tended to be younger, which makes sense. And if you were on your cell phone, there was a 94% chance you were getting discharged, as opposed to 64% if you weren't on your phone. Now, there's not a perfect study. Maybe patients who just are less sick and are there for something minor are going to be on their cell phone. It doesn't really kind of correlate that directly, but it's kind of a funny thing to look at. And maybe there's something to the fact that if someone won't get off their phone, maybe there's not quite as much wrong with them. So thanks, everybody. Have a good day.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.